All right. All right. Thank you. Here we go. We are live on Facebook. Thank you so much for joining me. And thank you everyone for your patience. We had a little bit of technical issues, but we're here. We figured it out. We are committed to getting this conversation out. Thank you so much
Absolutely.
for being here. And if you catch this later, please feel free to send us any questions that you would like for us to further this discussion on. So we're going to jump right in since we're a few minutes late. My name is Jackie Solomon. I am founder and executive director of Seeds to Inspire Foundation. It is a social justice education nonprofit located here in Phoenix, Arizona. And I'm also founder and CEO of Angel and Stone Transformational Coaching. But before we begin this really important conversation on health, lifestyle, and equity, I would first like to begin by acknowledging that I have the privilege of living, working, and playing as an uninvited guest on the unceded ancestral home of the Akimel Ottawa Pequash people. And I have been welcomed lovingly into this community in South Phoenix and the Phoenix metropolitan area. And with so much gratitude is why I bring this conversation forward. If anyone knows me, they know that I'm committed to health equity because of all the lifestyle changes that I've made, and I've been able to reverse all my chronic diseases, but also supporting my family members. My sister has MS, and I'm convinced that if it was not for our lifestyle changes, that the extreme weather that we're facing right now really could be much, much worse on her. And watching her be challenged and struggle this, it's even more important that we have this conversation to support our communities that haven't yet found lifestyle medicine or don't even know really what it means or where to start. So with that, I'm going to pass it over to my dear friend and colleague, Dr. Davis. Dr. Davis, could you introduce yourself and maybe share a little bit about how your journey to get to this conversation through your medical training, what was it about your journey through childhood, your education, kind of led you to this conversation?
There are like so many things. I'm from the beautiful island of Jamaica, just some background on me as a person. And I've always had this preventive focus. I think it was my upbringing, both coming from a island where we kind of had access to fruits and we were in like the natural environment. That could be one thing. I grew up watching my grandmother's health deteriorate over time, where she was already taking 20 plus medications, you know, and it fluxed, it was maybe a little bit less and then a little bit more, but I could see her going through those issues. And I remember actually writing about that in all my personal statements for medical school residency, just seeing her having to deal with life with a chronic disease. And I just saw how hard it was. And I said, there must be a better way. Upbringing from a religious standpoint, I was raised Adventist. So there's a very strong focus on health message. And that's a part of your ability to be able to be spiritually connected. And I think everything kind of came together just with my personality as well. I started looking into health in middle school. My mom started changing our diets where she saw something on TV. I think it was a like an interview on 60 Minutes or something like that. And she from there took out all the white bread, she took out all the soda, and we kind of shifted over. And that seemed to trigger in me this like desire to learn more about living well at a young age. So that's kind of how it started. And then finally, when I graduated from college, I knew that I wanted to do something in science. I still was deciding about medicine. And I got an answer. I actually prayed about it and I received a scholarship that I did not apply for from people at my college who said, we think, as a student going into medicine, we want to give you this scholarship. So I kind of said, okay, I think that's the sign to go. And from there, I was boarded in internal medicine, preventive medicine, lifestyle medicine, and obesity medicine. And all of that is because I want as much knowledge as I possibly can have to be able to help my patients really so to get the health that they want, get their health back. That's actually the focus, to get their health back. Because I think that health has really, our autonomy over our health has really been removed in so many ways, or there's a lot of things vying for that autonomy outside of us. And I feel like all patients, all people should have autonomy over their health. You decide what's going on with your health. Most people want to have, everybody wants to have good health. People don't choose but poor health. I think actively. I think it's because of where their surroundings. So that was where the MPH came in to give me a deeper understanding of how environment influences people so strongly in regards to their health behavior. So all of that together has, I feel, given me all the tools that I need to really help my patients the best I can.
Thank you so much for that background. And I feel it's really important because this conversation is still somewhat fringe and it's still so much, right? It's so diluted. There's so much missed messages that people are like inundated with all these messages. And we talked about that last time together. So
Mhm.
let's go into exactly these intersections that led you here, like all of your training, all of your education. Let's talk about why is health and health equity not in the same conversation?
I think that's so interesting because how can they not be? Is kind of the way I think about it, right? Because true health should be available to everyone. Why is health only available to some? And in our current society, just with the nature of how this society works, we have so much value in, um, I guess, profit-focused ventures, and healthcare has jumped into that arena. And so there is so much focus on being able to pay for care and, well, when health is our right. So I think the paradigm is we're not actually starting on the right foot. And it actually comes back to my thoughts about nutrition, where how do we not consider nutrition with health? But when we discuss it in just our general conversations about health, nutrition's like an afterthought in a lot of ways. It's like, yeah, no nutrition. It's like, no, you have to. That is the first most important thing you have to consider about your health, because how else do your cells work? That is where the cellular function is coming from, what we're eating. So that disconnect, it just tells me a lot about where we are. And even for health equity, how do we have health equity when we don't talk about health, true health, and how do we have health for health when it's not available to everybody? It just doesn't really make sense. So at least from the standpoint of medicine as an organizational structure and the aims, they do include that health equity is something that should be a part of the healthcare system, but that's conversation versus action, and the action is where we are still working to get there.
That leads me to kind of like the years. First, we've been working together on different capacity for years on this
Mhm.
topic and this messaging and getting this information out there. And so again, we talk about lifestyle and lifestyle used. The term is like it's just so overused. So I want to ask you,
Mhm.
is lifestyle really that important? What is lifestyle? When we talk about lifestyle, we talk about the connection to health. What is lifestyle? And is that really the conversations that are not being had in the medical offices and why we're so passionate about doing the work at the grassroots and community level? Like, how do we make those connections with what is lifestyle really? How does it relate to health? And why are we having this conversation in this platform with community?
I think if you break it down from the word lifestyle, it's a way of doing things. It's a way of life, a way of living. And so there is a repetitive nature to that. There is a um, kind of indication of habits being a part of that. And so lifestyle is really about the things that you do on a daily basis, those little things that you do every day. And I think the way that we think about lifestyle has become this overhaul your entire life tomorrow. and and that thought pattern is already very overwhelming, especially in our current climate where stress is such a part of our daily existence because the nature of the society and the way it's structured promotes a lot of stress. For example, we don't even have siestas in the US. Our vacation time is less than a month for a lot of people. While in other countries, they're on vacation for 3 months. They have a period of about 2 to 4 hours that they don't do anything at the latter part of the day. So the way the structure of our society is very stress promoting. Same thing with the food culture. Our food culture is weight gain promoting. Our food culture is inflammation promoting. It's obesity promoting. So it's part of how that environment is set up. And so the environment then feeds into our behaviors and our daily behaviors, our daily little actions are so strongly pressured from these things that are around us, not just physically, but more importantly, the cultural part of it, you know. Because even I was thinking, I was like riding home, I was at an appointment this morning and I was coming back home and I was thinking how Happy Meals have been so permanently fixed in our culture as enjoyment for children that when you think of fast food, you actually think of kids now, fast food and children. So, and I'm not talking about fast food and thinking, oh, you can't have it, but it's the idea that when we think of fast food, it's so linked to that. And we know that fast food cannot be a main part of a child's diet because of where the nutrients are lacking in that. So just some thoughts around that, but it really is the daily habits that we do every single day.
I'm so glad you brought up children because, again, you know me, that's my passion. And I was remembering when I was preparing for this that when I was young, and I'm sorry, I'm a kid from the 70s and the 80s, and I remember like diabetes being something that you were either born with or
Mm,
you got when you were much, much older in life.
right,
And
right,
then
right.
when I hit my 30s and 40s, diabetes got me. And I was like, oh my gosh, my husband had diabetes. I had diabetes. Several family members had diabetes. And it was like,
Ah,
okay, what's going on?
mm,
This is now decade and a half later, and now children. It is
right,
ubiquitous. These diseases, diabetes, the obesity, the hypertension, the non-alcoholic fatty liver disease are all in our children. And this is
right.
very scary in one generation to witness this. And I was also speaking to a client about why people kind of like in their 30s and 40s feel like they feel old. And like, what is that about? Why do you feel
Yes,
old?
yes,
But if you
yes.
think about it, our quality of life and actually our life expectancy has diminished so greatly, and our
Mm-hmm.
communities are losing our lives to these diseases so much earlier that we are middle-aged in our 30s and early 40s. Maybe that's why we feel so old. So can you connect us with those of us that are just starting this journey and have all these
Yeah.
different diseases and are saying, really, does lifestyle really affect chronic diseases? Does it really affect autoimmune diseases? Does it really affect diseases and conditions like hypothyroidism? We had someone respond to us and ask about that. Can you help us understand lifestyle, specifically lifestyle medicine and the pillars? And how does it affect these things that feel very different in our bodies? Can you help us see that connection?
I think it's the reality that let's say take it a step back to how your body was designed to function. So your body has a personality. I always say that the body's personality is health. It likes to be healthy. It's always moving in the direction of health. And the easiest example is you cut yourself, and within about 3 seconds, your body, actually immediately, your body's already started that process, but probably within about 3 to 10 seconds, you're already developing a clot. So the body is programmed to try to heal you all the time. So everything is toward this tendency. So if we're seeing that we are having deterioration of health and it's across the population, something is wrong there because your body's not designed to deteriorate and just kind of fall apart at 30, 35, 40, 50. So that's one thing to note. Then we think about the fact that we are made up of trillions of cells, and cellular function is how we function as individuals, as humans. So our cells' job is to keep us alive and well. It can keep us alive. We can be well, but they need to be together because you could be alive and not doing so well. Hard to be well and not alive, but you know what I mean. So that's a part of it. And our cells are the building block of function in our bodies. So if your cell is missing nuts and bolts, which it will be missing if it's not getting enough nutrition, then it actually doesn't function properly anymore. And so its ability to clean, its ability to repair, its ability to function at optimal level is compromised. And so things break down. And when we look at diabetes, heart disease, fatty liver, all these different illnesses, it's really an issue of the cell being dysfunctional, breaking down, deteriorating. It can't repair. Damage has been done and it's struggling to repair, or it's struggling to clean out, build up. And I always use this analogy with my patients. I'm like, think about this. You have your garbage, you take it out once a week. What if you stop taking out the garbage? What's going to happen? Yeah, in about a month's time, we don't want to go in that house. Right? So that's what happens when we're not getting enough nutrients to actually regulate the cells properly. Things are building up and not getting cleaned out. They're causing damage like inflammation, oxidative stress, all of these cellular processes that are so critical. But we don't even have to get down to that level. We could just think about lifestyle being ways that we live that actually protect us from these types of cellular dysfunction. So what we eat, the nutrients provide us with the tools that repair and heal. Stress management helps to protect us from overactivation of our defense systems. So when our defense systems get a little too sensitive, then that's when we start to get some internal damage because they're hyperactive. But we have to have a way to calm them down and reset them. Stress management is a part of that. Sleep is also a part of resetting. If you leave your phone running, it's gonna die. You can't forever go without sleep. Sleep is a part of where your cells get cleaned in the brain, especially. It helps with memory. Then we have exercise, which is like a glue. I think of exercise as a glue because it helps to allow all your organs to function at the highest level. And then connection. We're humans. We cannot live without connections to other humans. A sense of belonging is how we actually feel whole. And that is just in community. So being isolated, that does not align with us as humans. Lastly, having a sense of awareness of what's going on inside yourself, how you're feeling, what's going on with your emotions, what's going on with your body. Being in tune with your body is important because you can feel something's not right. I had a bad day, I'm feeling upset, what's going on there? And being able to process all these things is so important to know what to then do to help yourself get back in balance. So they're all connected, they're all important.
Thank you so much for that. That overview is so important. And I want to kind of pull into the two pillars that I specialize in, especially with Seeds to Inspire in my private practice, is really about kind of managing our health to the best of our abilities so that we can face these other challenges outside of us that we
Right.
have little to no control over. So how do we
Right.
get ourselves as healthy, incorporate these tools, get ourselves connected in community to support each other so that we can face these things better? So let's talk about the two things. And what I really want to bring up is that inflammation piece, because you mentioned that and it's so important. So I want to kind of talk about that interpersonal stress, which is like what I specialize in with my group coaching and that community to support each other, but also that food as medicine piece is so important. And we've had a lot of questions for the community is like, okay, where do we start? For instance, quick anecdote, I have a client who is a very intelligent person, who is a worldly person, a family person, has lived and has never heard the term multiple sclerosis until she was diagnosed. So
Mm.
where do we begin when there seems to be this distance and disconnect from this basic knowledge that we should know of how our body functions and how these things that we consume, whether it be relationships or food, affect our health with like fiber and inflammation. Can you help us make the connection of like what is it about the nutrition piece that is so important to deal with these diseases? Not just being vegan, the term vegan, really about the nutrition of whole plant based foods for the mitigating of these symptoms and possibly reversing of these diseases.
When I talk to my patients about nutrition, I specifically use the term cellular machinery. So I describe nutrients as pieces, parts to a machine, which is the human body. So if you go to the mechanic and, you're like, all right, just check out my car, make sure it's all good. And then the mechanic starts buzzing up on the wheels and zoop, zoop, zoop. And about 18 things he's done taken off the wheels. And then he goes into the engine, zoop, 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 about 10 pieces he's taken out there. He closes everything up and he's like, all right, see you next week, Jackie. You're like, am I missing something here? What do you're not letting me drive on the road with that car. Because at any point something could fall off. But when it comes to nutrition, in essence, a lot of us are living with these pieces not included in this machine. And at any point, something could fall off. That's actually what's going on. So we are lacking key pieces of the cell to make it, allow it to function properly so that we can be our best. And that's what I tell my patients. All of this is not because I said so or because the guideline said so, or that's what you should do. And yes, you're supposed to eat your fruits and veggies. It's so that you are feeling good, so that you are feeling your best. And if we start to create a different type of frame on that, I think so much of the health conversation is this type of like test or bad or good grading. Like people have a sense of them being graded in their health, because I talk to patients all the time, and this kind of notion of, I know I fell off, and there's this failure thing. I fell off, I was doing great, and then I messed up, and it's like, I messed up, I failed, I got an F on this health test. That's not what it's about. It's about how you're navigating. And so when you hit that bump with the stress situation, which usually is where people feel like they're thrown off or kind of get a wrench stuck in their wheel, it's like, okay, let's regroup. We got to regroup and see how you can be able to link back into these life-saving strategies. And that's the opportunity for that versus that indication that you failed. So, excuse me. So nutrition is so key because it allows for the cells to function as they should. And just getting back to your inflammation piece, when the cells are not functioning properly, inflammation, which is an indication of chronic damage, inflammation is the body's response to damage. If we have chronic inflammation, it means that there's some type of chronic damage happening. If your cell has incurred damage, is unable to repair that damage still exists. Chronic inflammation then ensues because this chronic issue, this damage is still present and not getting repaired. So it is all connected. And that's why we see such powerful responses where people can flood the body back with nutrients and things can come back to baseline, because that's what the body was missing from the beginning.
Okay, so let's bring this down to basic practical terms, because what I feel again is so important is to talk about that health equity piece. Now let's bring these conversations together. Why is it that so many people in our communities don't know what these diseases are, don't know how they function in the body, don't know that we have the power and that there are solutions and that there are interventions that we can incorporate into our lives like lifestyle medicine? Can you help us understand why is it that you and I are having this conversation here? Talk about health equity and how these two topics relate.
I think it's multi-layered. And I think the openness to which these conversations need to be had, that hasn't been something that's been made kind of our cultural practice. And I think that's just because of the nature of how society has structured experiences for a lot of marginalized communities. It's created environments that promote stress for people. So then people are in kind of a survival mode, and it's like, I don't have time to be talking about health. I have to get basic needs met. And so it kind of has this culturing of health taking a back seat for many people, because so much of the lived experience can be so stressful. So it's like, I just have to focus on this, right here. That's too much to take on. And just other dynamics culturally where people aren't talking about health. We know that with men, that's an issue we see all the time. Men not going to the doctor, different cultures having that type of distrust of the healthcare system. So, it's not based off of nothing. It's because historically there's been concern, there's been apprehension, there's been fear of entering into this space because of what could happen, mistreatment, bias, racism, discrimination, all those things. So it's really historically, culturally, this type of response has been created, and we're just dealing with the ramifications of all those effects over time, decades, where people are like, this is kind of how we operate, trying to protect and maintain what I need to at this point in time. So I think, no, it's a time for us to, and we always talk about this, Jackie, linking into the right that we have to our health, we actually have to step into that space where we're like, no, we're going to actually prioritize health. And we're going to start talking about it because that's the only way we can actually reclaim our power over this and be able to focus all our energies together, which makes it stronger, to be able to be empowered and have that kind of autonomy over health again.
And this segues beautifully into the topic that we'll be discussing in further detail in the following webinars about really that grassroots movement. So I want to take it back to, like, again, the basics. My work is really and has always been about community development and community solutions. And I am a visitor here. I got here in 2010 into the Phoenix metropolitan area because I was on a healing journey from a tragedy that my family experienced. And I've been so blessed to be supported by community members that are all about empowering and healing and spreading the message. I have colleagues like, I'll just give them a shout out, like Kiosha Hooks and Rosalind Akins and Leo Victoria and Nisha Higgins, and if I've forgotten your name, Carnita Wallace, all of these leaders that understand this message and are really here as leaders in the community. And all I want to do is be able to bridge this information and the conversations that are happening out here in the macro and how it impacts us. And we have talked extensively about it being a grassroots movement, it being starting truly to make the changes and affect the change that we need to have, because we're in a critical stage right now with our health. Absolutely.
100%.
So
Yep.
how do we start right here with the community? Can you share a little bit more about your passion with the community level, mutual aid, community building, health and resilience? And not just as resilience, as my colleague Rosalind Akins is always talking about, it's not just about resilience. Resilience got here. It's time to thrive. It's time to really take back our health and step out of that and thrive. How do we do that? And why do you feel that the grassroots movement, it really is the way to get us there?
I think that grassroots movements have been the only thing that have made any change. I mean, even when we look, and I always think about the civil rights movement as an example where that was not a top-down type of effect, where whoever individuals at the top said, you know what, this is a problem, we should really change it. It didn't happen like that. It was people at the bottom saying, my right to being a human is important and will be respected. And people said, we're done. Like, I'm tired of this discrimination, this mistreatment. This is not how it should be. And so we're going to reclaim what is rightfully ours. Health is rightfully everybody's. Every person has their claim to health. And so that's something that I think we need that kind of mentality to say health is my right and I'm going to reclaim it. So I think when we move in that direction, then it makes sense. And once we begin to activate that in ourselves and begin to connect with each other, it becomes like a network. When something is by itself, it's pretty good, but strength is in numbers, strength is in powers and numbers, strength is in people coming together. And community is where healing, in my opinion, happens in the best way, in the most miraculous way, in the fastest way, because now we're starting to redefine a different type of culture. And you can create culture with people. You absolutely 100% can create culture with people. It doesn't have to be a large group of people. It can just be committed people who are engaged in the same type of lifestyle together. And you can establish that, and that can be protective in spite of what else is going on. So I think grassroots, that's what happened. Individuals were activated and then they linked arms with each other and then they pushed these things forward. And it was from these grassroots efforts that led to the structural changes, the political changes, the changes in the law, Civil Rights Act, all these things. But it did start with groups of people and then it eventually grew and grew and grew and grew. And I feel like we're in this time right now. We talked about the statistic where the fastest growing plant-based eaters are African Americans. That's not for nothing. That's for people saying, my right to health, I'm going to claim that right to health. People are educating themselves. They're understanding the importance of their health and how valuable it is to them, and that they have a right to live in this way. And I think that's what we're seeing. And like you said, this is like the time for us to really push to be in space together, to heal together.
So as we start to close on this portion of this conversation, can you bring us down to, again, back to the basics? This is a grassroots movement. We're coming together in community to heal. We, at least my intention, and I do have a goal, it's selfish, but I do have a goal, is that I want to mentor and I want to partner with community members that are already doing this work, that are already working on this healing. I would love to be able to empower individuals so that they can be that pillar in their families, their community, their work, that not only regain that health, but have the language and have the information so that they can make informed decisions, so that they can mentor others to make this change. Like, we have to keep doing this. So where do we begin? It feels like it's very big. And again, we're going to continue to have these conversations, but what would you offer anyone that's here in the room, that's listening live, that can walk away and say, okay, I just learned all about this. Where do we begin? What are first steps on this journey towards making these changes?
I think you have to reflect and know that you have a lot of gold inside of you already, because a lot of times the conversation is you have to adopt all these things. You have to take on this thing, you have to change yourself in this way. And yes, there are shifts that happen, but it's like all of it is coming from this person. And it's understanding that I actually have a lot of skills. And you talk about this all the time, Jackie. I actually have a lot of skills that I've already practiced in other areas of my life. And I just haven't made that connection. I haven't aligned with how the healthy part, the healthy living is me expressing the skills I've done in other ways. I have like so many patients, they're kind of they're upholding their families. They're seen as rocks and pillars in their families. For you to even be in that position, you have a lot of skills, right? You have a leadership skills, you have organizational skills, you know what I mean? For their jobs, they work these jobs that are sometimes very stressful, but it requires all of this effort. And it's like these things can be translated in your real in your into your health. But I think you just have to start where you are and know that shifts can be made, shifts can happen. They can be very minute, very small. And then you want to work on how you can be consistent with it. So you do not have to start with something insane. That's what I hear a lot from people making changes. People want to go 0 to 60 like today. And change never really happens that way. It actually happens with slow and sustainable changes over time. Even anybody who is plant-based and they seem like they're living the best, healthiest life, if you really look and listen to their stories, they have gone on a journey where those changes were happening. Sometimes it was a strong initial change and someone passed away and they said, you know, I'm done with this. I'm throwing away everything in my fridge. I do hear those stories too. But if you look at how things kind of continued, it was still a journey. You know, they might have had a setback, but they continue back on because they said, this is valuable. I have to move in this way so that I can live the best life for myself. So I think you start where you are. You have to value yourself and what you have, and that you do have the resilience, you do have the skills already inside of you. And it's just a matter of gaining that I would say joy from the daily progress of you taking care of yourself. There's a lot of joy in that people don't talk about. We always think about the destination as like, this is the big achievement. I've lost 20 pounds, I've lost 80 pounds, but that's not where the joy comes from. The joy comes from every day that you commit to yourself that you're going to take care of yourself and you're doing it. There's a lot of joy in that.
And finally, without sounding histrionic, but it is a critical conversation, and we are in critical times health-wise. Um, the healthcare industry, we have doctor burnouts, we have my brother-in-law takes his parents to the cardiologist, and literally the cardiologist had to double the waiting room because of all the patients and the wait times. I have parents that are waiting 6 to 8 months for subspecialists for their babies that are getting these diseases. This is critical. So can
Yeah.
you explain really what you see as going on and why we are using the word critical in this
Yeah.
conversation?
Jackie, you were so on the money with the term critical. And I think that we're still in the process of developing awareness as a community, as a society, as a nation. The facts are there, but we haven't collectively developed that awareness to say, oh my gosh, wow, like this is actually the situation that we're in. The fact that even in my experience, my patients are now booking out 4 months. So when I first got there, it was, a month, 2 months, and it just keeps getting, longer and longer the longer where I'm practicing. And that's because so many patients need to be seen, because we focus on the wrong things. We focus on basically we focus on waiting for things to happen. And then we jump in with all of the resources, all the money, all the effort to then fix something that's broken. It would make a lot more sense to strengthen the thing initially so that it's not hard to break. That to me makes the most sense. I mean, it could hit up and bang up on all these things. It's not breaking because it's fortified, versus you are not investing and making it so it is not strong. And then any little thing, boom, we're done. So we focus too much on waiting for things to happen. The analogy I think about is people walking backwards on a cliff and we're just watching them. There's no railing on the cliff, and we're just watching them walk, and then they fall down and we got everything at the bottom. We even have a hospital we built in the desert to take care of people. As soon as they fall, we're like, oh, there you go, we got you, you're the first in line. It just does not make any sense. And this is where we are doing things that are illogical. And I think the only way you can do something illogical is if something is driving it in that direction, because people are very intelligent and they would be like, that makes no sense, I would never do it that way. Right. So naturally, people want that. And when patients come to me, they're saying, wow, I love that you focus on prevention. I love that you're trying to help me get well. I love that you're trying to help me build healthy habits. So that is where we need to focus. If we were doing that, we wouldn't have so much burden of disease that is literally pushing and has pushed our healthcare system to a breaking point, because we are actually seeing evidence of a breaking point. Just like you described, the wait times, all the different things that people are suffering from across the spectrum of diseases. It's increasing every year, the incidence of disease, causes of death of disease. The procedures continue to amplify to try to improve these diseases. It just doesn't make sense.
Well, we are reaching our close, so I have a few announcements to make, and I'm so grateful Dr. Davis has elected to join us for this conversation. We're going to continue on. So what I want to do is I want to invite you all to register on Eventbrite for the next 3 Wednesdays in July as we continue this conversation. We will be in the room, so we would love to have you in the room. We want to have an engaging, interactive conversation. We want to continue to build this and learn how to do this even better by bridging the gap and making sure that we develop these community conversations. So we invite you to be in the room so you can ask questions and give comments, but we'll also be streaming live on Facebook for those of you that can't make it. And we ask that you just kind of share and invite other people. We'll also be uploading this into our YouTube channel. So we ask you to like it, share it, invite other people into the conversation. Another announcement is that I will be launching at the end of August a group coaching cohort that will be focused on multiple sclerosis, fibromyalgia, and lifestyle medicine. It will be a small cohort because, again, we want to make this intimate and we really want to make this a space where we can connect deeply to these conversations. So there will be a maximum of 12. So if you're interested, please reach out. And again, Seeds to Inspire Foundation, we are available and excited to come and join you to do webinars, workshops. We teach cooking, food is medicine, and we also do taste testing. So if you want us to come and share this and teach and collaborate, please invite us. You can reach us at our website, seedstoinspire.org. If you're interested in coaching, you can reach me at my website, angelinthestone.com, also on Instagram at Seeds to Inspire. And I want to invite Dr. Davis for a few closing words, and please share with everyone how they can follow you and learn more about you.
Well, I will say definitely follow up. We want to see you at the next conversation. Follow Seeds to Inspire. Jackie is doing amazing work. She is the person, like she's just so skilled in bringing all these things together and creating community with people so that in community people can heal. that is how it should be, because we should have been healing together from the beginning, right? It's the fact that the community has actually been developed in a way that again structurally has not supported. So now we're at the whim of this cultural experience. So please do connect, because this is going to be life changing. That's what I can say from my heart, honestly. In terms of my contacts, MGD the doc. That's pretty much it. MGD the doc. That's on IG, and that's also my website as well. And I'm going to be putting more information on Instagram. I'm really hoping it can be a resource for people. And yeah, that's it for me. Oh, Jackie, you're on mute. Okay.
Thank you everyone for joining us. And again, we hope to continue this conversation, go deeper, richer, and figure out ways how to get people healthy, how to get us connected, and how to love one each other better. Let's get rid of the stress. Let's eat really well. Let's support each other, making sure we have access to all this life-saving information so that we can be thriving elders for the babies. Let's make sure the babies have an environment that they can live and they can fulfill their potential, and make sure that we're around so we can guide them and mentor them into adulthood. Thank you so much for joining us. Thank you, Dr. D, and we will see you next week.
Thank you,
Bye.
Jackie.